morning. This is Mike Mancuso from the Triangle East Chamber of Commerce with our next edition of Connection Point. We are honored this morning to have Dr. Marilyn Pearson from the Johnston County Health Department with us this morning. Good morning, Doc. How are you?
Good morning, Mike. How are you?
We're doing wonderful. Thank you. Appreciate you taking time out of your very busy schedule to be with us today. Wanted to, first of all, learn a little bit about who Dr. Pearson is. Can you tell us a little bit about yourself?
Sure. I am originally from South Carolina. I am one of four. I'm the oldest child in my family. So my parents are still in South Carolina. So I was raised in South Carolina and attended high school there and then went to college at Clemson University. Go Tigers. And after attending college at Clemson, I actually worked at a pharmaceutical company as a microbiologist. I do have my degree in microbiology, and then returned to school. So I went to UNC for medical school, and then completed my residency in family medicine at Carolinas Medical Center in Charlotte. And then ended up here in Johnston County. I've been here at the health department since I completed my residency in 1998. So I've been here 22 years.
Very good. Well, we are excited to have you here in Johnston County, especially in these uncertain times. It's I know personally I've been able to reach out to you multiple times with questions. And you're always right on it and getting back to folks here in the community, so we appreciate that. Next question here is I think you kind of covered how you got into the arena of public health. Can you tell us a little bit about your department and the work that your team does?
Sure. Public health is, exactly what it says. It's improving the health of the general public. Our goal is to promote health and prevent disease, and we try to do that with different programs and partners that we develop in our community to focus on health issues. So as a public health department, we provide primary care, and that is not the case in all health departments in North Carolina. But we do provide adult and pediatric primary care. We also provide services, women's health services, family planning and maternity services, prenatal care, and health education and WIC program. So I think everybody knows about WIC, Women, Infant, and Children program, that provides food and support to families and children that are in need. The other thing, of course, that we do as a public health department is our communicable disease department. That's what most people know public health for. The things that we do, immunizations, monitor communicable disease outbreaks in the community, TB, for example, sexually transmitted infections, those type of things. So those are all things that we do as a public health department. In addition, our public health department has a behavioral health division, and that again is a little bit different than other health departments here in the state. So we have psychiatrists, licensed clinical social workers, general social workers, and other staff that provide services here in our county. We actually serve as the walk-in crisis provider here for our county. So if there are behavioral health issues or concerns, Monday through Friday from 8 to 5, we are a walk-in crisis center for people and residents in our county in need. In addition, we have an environmental health department, and many people don't realize that those that do restaurant inspections, septic system permits, etc., they are part of our health department. So we have our three main divisions, which are our preventive health division, we have our behavioral health division, and our environmental health division. All of those things and all of those groups work together to try to keep people healthy here in Johnston County.
Wow, that's a lot, and I think the general public really doesn't understand all the heavy lifting that your team does on a daily basis in so many ways. I know I've spoken to a number of our member restaurants that talk about working with your your organization, and they love how you guys work with them to make sure that things stay safe, for sure. So we're coming into fall, and I went at the beginning of the month, got my flu shot. Tell us a little bit about the normal things that everybody should be dealing with right now, or taking care of outside of COVID. We'll get into the COVID issue in a minute.
Yeah. So you're exactly right. This is flu season, and it's a great time for us to think about our health, and then trying to keep ourselves healthy, and all of those in our circle. So flu shots are recommended for everyone 6 months or older, unless there's a contraindication, particularly this season with other respiratory viruses circulating. We encourage everybody to go ahead and get your flu shot. There's also a high-dose flu vaccine for those that are 65 and older. And so if you are 65 and older, multiple providers will have that available, which provides a little bit of a boost of the immunity that you get from a flu vaccine for those who are our seniors, and we do encourage that also. Our health department is offering high-dose flu vaccine for those 65 and older at this point, so you can also call us if you would like to get that vaccine. In addition, COVID is something that's taken over everything else, but we also need to think about the other things that are affecting our health. In our county, our top causes of death are heart disease and cancer. We also have respiratory illnesses, emphysema or COPD. So you should still be thinking about those things, trying to take care of yourself and seeing your provider. We all have put safety measures in place so that when you come to see us or we talk with you about your health issues, we're as safe as possible. So I encourage everybody to continue to follow up for those things, your diabetes, your high blood pressure, your heart disease. Continue to take care of yourself so that you can stay healthy.
Thank you. I appreciate that. That's so true. I just saw a report last night on the news about folks delaying that regular care and how it's starting to adversely affect folks. But so great reminder that everybody needs to get out and take care of themselves.
Yeah.
So let's talk a little bit about the current situation around COVID, and specifically my questions are around COVID and business. Our businesses are struggling to get back to where they were. Many are, limited in how many people can come in. Restaurants are at 50% or outside. And one of the things that I'm getting questions from our members is what happens if, somebody tests positive in my circle, in my business? What are the steps that I need to do to make sure I keep all my team and my customers safe?
Thank you for that question. We continue to try to work with our employers or other agencies, trying to be sure they are comfortable and understand the process for how we deal with our cases that we have here in our county. So initially what happens, if they are aware of a positive case before we are, then we would ask that they contact us. Usually if we receive a positive case, we will contact the employer once we get that case, because we feel it is important for them to know and also to protect their other workers there. So if you do have a positive case, we would be working closely with you to look at who also may have been exposed in that case. So we would talk with you and get information about your other employees that we may need to talk with and provide some guidance to. So I would hope that all of our employees have some screening processes in place to be sure that people aren't coming in sick or with symptoms themselves. And then once we determine who might be a close contact, we can work with them to provide information about testing and quarantine. So isolation is for those who actually are diagnosed with the disease or have a positive confirmed case through the lab. So that's what isolation is for. Those who are positive, it is recommended isolation for 10 days. And then quarantine is for those who may have been exposed or at risk of infection. And quarantine is recommended for at least 14 days. And it will depend on whether, a household member is positive or someone close in your circle is positive. But 14 days is usually the minimum time for quarantine.
So what happens after those periods of time? What are the next steps kind of for reentry? Say I've tested positive, I've done my 10 days, I've got no symptoms. Is there anything that I need to do before I can go back to work?
Sure. The recommendation is that once you've completed those 10 days of isolation or 14 days of quarantine, that you can return to your normal activities. A repeat test is not recommended at this point, and a part of that is the research shows that tests can be positive for up to 3 months. So some people have had negative tests, but having a positive test does not necessarily indicate infectiousness. So it may be that you might have a positive test, but if you have no further symptoms, have been improved, or even those who are asymptomatic, because we've had positive tests where people have had no symptoms. After that 10 days, it is thought that you're not infectious and you can return to your normal activities.
Any other precautions that person should be taking? I mean, we're all in that mode now where we're wearing a mask, where we're in gatherings or close by. Tell us a little bit about those kind of precautions.
Of course, we all encourage, the 3 W's. When you're out and about or with anyone who is not your family member that you're living with, of course, should always wear your face coverings, and that should cover your nose and your mouth. So we try to be sure that people know that your nose, yes, it does. Yes, aerosol does come out of your nose. Droplets come out of your nose too. So be sure to cover your nose and your mouth, and physically distance. So try to stay 6 feet apart as much as you can, and of course washing your hands. All of these measures improve or decrease your risk for getting not just COVID, but other respiratory viruses, for example, flu. So we always encourage everyone to do that. Even now in your workplace, if you don't have cases, it's great for everybody to be wearing a mask. If you're in an office alone by yourself, that's a different story, as I am talking to you. But when others are in the room with you, or within that, closer than that 6 feet, it is recommended that you should be wearing a face covering.
Very good. So what other tips do you have for our businesses as we are now going into the fall and the winter months? Going to be a lot more indoor activities. Any other precautions or things that businesses especially should be looking at during this time?
I think if businesses will continue to screen their employees or those coming into their facilities, that will be a process that I think should be in place. And continuing, of course, to do those 3 W's when you can. If you can utilize meetings like this, video meetings of telehealth, to decrease the number of people in a room, that is always a good idea to do that. Those who are working a lot with the general public, being sure that you have things in place to try to protect your staff. For example, if you have plexiglass that you can put in places to protect your staff, that will be helpful. And then providing hand washing or hand sanitizer stations so that people can continue to wash their hands and keep their hands clean. Those are things that you can do to try to keep people healthy.
When you talk about screening your employees, can you tell us a little detail about what you'd recommend from a screening perspective? As you're starting up and opening up in the morning, what are those steps as your employees arrive? What should we be doing?
So one of the things I recommend is that, you should tell all your employees, if you're sick, don't come to work. Please be able to allow that so that they won't bring any illness into your workplace. But then thinking about, are you having any symptoms, any fever, for example? If you have been in close contact or living with someone who's a positive case, which means you should be quarantining and not working. So, people, those are good questions to ask. And then if you have a new cough, some shortness of breath, loss of taste and smell, and that's one that a number of people have had. So those main symptoms that we have noticed with COVID. COVID masks itself as other illnesses. So there are multiple different symptoms that you can have. So what I recommend is that if someone is feeling sick, not sure why they're not feeling well, that they don't come to work and get evaluated by their provider.
Very good. Thank you so much for all these wonderful tips. Is there anything else you'd like to share with us this morning before we wrap up?
No, I think all of us need to think about COVID, which is coronavirus, this virus. That's a very serious virus. If we look at the number of deaths in the United States, it's the third leading cause of death right now. And it's in the top 10 for our county with the number of deaths we've had. We've had 62 deaths related to COVID. This is a virus that wants to propagate. It just wants to spread. But we can control this. We can take care of this if we do the things, the 3 W's, wearing our face coverings, washing our hands, and staying 6 feet apart. Those are things that we can do. We have some control over this. And we need to, use that control and try to protect ourselves, our families, and our friends.
Well, thank you. I appreciate all that you and your team are doing for us here in the county, keeping us safe. And please, anything we can be doing to help you, please just give us a call.
Sure. Anytime. Thank you.
Thank you.